Peptic ulcers I told you to read about. An ulcer in the stomach is just an erosion of that mucosa, and it can be as bad as eroding into the past that mucous membrane layer into that second layer, which is, so we have mucosa and submucosa. That submucosa is always bad to erode into because it's full of blood vessels and nerves, that sort of stuff. You can cause bleeding, and ulcers can be as bad as like all the way through all four linings of the stomach and into the, like popping a hole in your stomach is not good. So ulcers are bad. And the main culprit they identify a lot of times is Helicobacter pylori, a bacterium that we can find in our stomach. That was the point they made with peptic ulcers, but ulcers can be from a number of things. So just kind of highlighting the main causes of ulcers. That bacterium is usually a culprit. And another thing that I didn't mention, we were running out of time, but in that same peptic ulcer, it talks about anti-inflammatory drugs, NSAIDs. So your ibuprofen, your Advil, all the stuff that kind of fits in that, naproxen, all those things that fit in that category, these are non-steroidal anti-inflammatory. They treat inflammation. They try to reduce inflammation, which sometimes we want to do. But a side effect of those can be that they affect the mucus production. So if I don't produce enough mucus in the stomach, what do you think happens? Mucus is lining the whole stomach, protects it, so acid gets through. Acid starts to cause ulcers. So overuse of things like really strong NSAIDs, taking 800 milligrams of ibuprofen like 4 times a day your entire life is going to give you stomach ulcers, like 9 times out of 10. Yes. Yeah, it's eating through the layers, yeah. A lot of stomach ulcers are just erosion of the layers, right? Like, typically it's going to be related to your acid. So sometimes people have a more acidic stomach acid, or in this case, I messed up my mucus production, so now I don't have the same protection that I would normally, and it eats through it. So that's the stomach. So chyme leaves the stomach and enters the duodenum, which we're about to talk about, through what? What is it going through? This is like valves or whatever. Pyloric sphincter. Pyloric sphincter. Lower esophageal is LES. That's when it came into the stomach. It leaves the stomach to the pyloric sphincter. So, would you see that question on your test? I don't know. All right, moving on. So, liver. Okay, so our book takes a little bit of a sidestep here. So far we've kind of just followed the digestive tract, right? We've said, okay, food enters the mouth. Let's talk about where food goes and how it gets broken down. We're taking a little sidestep. We have to. And I say a sidestep because these are organs that we're about to talk about that are known as accessory organs. The book made that point too. Liver, gallbladder, pancreas is what the book talks about next. And these are all accessory organs, meaning that they accessorize the digestive tract, get the job done of digestion, but they do not have food passing through them. Our liver does not have chyme passing through it. Our pancreas does not have chyme passing through it. So that's usually how I make the distinction between like the tract that the food follows and our accessory organs. These guys, food never touches them, but they are super, super important for the digestive system. And we've talked about the liver a bunch. We've mentioned the pancreas. I think I mentioned this before. What else does the pancreas do for us in the body? Makes insulin and glucagon, so it's a huge role in endocrine, right? Liver does a lot of stuff for us. Liver's a lot to do with red blood cell destruction, red blood cell production. Liver does a lot of things for us. You could name, I think the book tells us it has over 250 tasks or something like that. There's a lot of different little things our liver does. It stores glucose, so it can kind of have a little bit of an endocrine effect. Remember that glucagon from the pancreas targets the liver to release glucose back into the bloodstream. That's what glucagon does. So the liver does a lot of things. But we're going to focus on what does it do for helping us digest food, okay? So first we're talking about the liver. Liver is located-wise. It's in your right upper quadrant. And you can see it on torso Terry here. Liver's huge. It sits underneath your right side ribs pretty far. And you may have had a physical where someone wanted to palpate your liver, and they'll lay you down and you make you take a deep breath so they can kind of stick their fingers under your rib cage. It's real fun. At least that's how a proper assessment's supposed to go. If your doctor's never done that to you, well, they're not doing proper assessment technically, just saying. But liver's pretty big. So you can see it takes up majority of our right side of our abdominal cavity. And it should be that big because it does a lot for us. The liver does technically get broken up into a right and left lobe. Not too stressed about that. I don't think that's irrelevant. What that does mean, though, is that it's kind of got separate blood flow, a little bit like the lungs. And so this is why it works for some people can have part of their liver donate. So if I had a friend that was in liver failure and my liver was healthy and good, I could donate part of my liver and still be functionally okay and save their life maybe. Of course, that would mean that I'd have to match blood type and about 6 other factors, so that would be unlikely, but it's possible. The liver is also really unique as far as scientists know. Liver is one of the only things, the only organ. Now, I'm just saying this boldly just as a fun fact, but the liver is the only organ that we know of that can actually regenerate on its own for the most part. So if I take out part of my liver, some of it will grow back, which is wild. Why is the liver the only one that does that? I don't know. But it's weird. That's what it does. But yeah, so a lot of stuff. Storing glucose, releasing it, processing vitamins, minerals, filtering toxins, recycling old red blood cells. Does a lot. But it does help us play a crucial role in digesting food too. If you hear the term hepatic, so that means liver, so hepatic anything. Some of you may have heard hepatitis, right? Okay, and you guys can infer if hepatic means liver, itis means inflammation or infection, so hepatitis means I've got inflammation or infection of my liver. Typically hepatitis is referring to the disease, but it's just a virus actually. Hepatitis A, B, and C are all viral infections, technically. One of those is, it mentions hepatitis. Swelling, inflammation of the liver is called hepatitis. So that one is confusing because hepatitis is actually, it's in that fast fact there. I think you need to know what hepatic means, and I think it's worth hearing hepatitis and just knowing we're talking about swelling or an issue with the liver in that regard. The book makes a point which is really interesting. We've heard of the diseases, hepatitis A, B, and C. Those aren't really great names because hepatitis is really the symptom of those diseases. But they just keep them that name for a reason. But you don't have to know hepatitis A, B, and C yet, but you will eventually. Some of them we have treatment for, cures for. There's hepatitis B has a vaccine. Hepatitis A is usually pretty benign. That one's transferred fecal oral route, which means if you go to a restaurant and you get hepatitis A, it means you had poo particles in your food. You're welcome. That's what fecal oral route means, ingesting fecal material. You're welcome. That one's usually pretty benign, can be treated. The hepatitis C is treatable these days, but it's still can be a killer. It was a bigger killer years ago, but that one's transferred blood and stuff like that. My great aunt actually died from liver failure because of hepatitis C from a dirty needle, in the 80s from a tattoo. So, which she didn't know it was dirty, but So don't worry about the hepatitis diseases. You'll learn about those, but it's not a bad. Hepatic is a good word to know for liver, and hepatitis is a good word to know. This backside view is a good view, and you can kind of see it on this little diagram. Nah, they don't really have the blood lined up. You can see the gallbladder that we're about to talk about hanging out back there. But this posterior view is a good thing to kind of just look at. But guess what's here? The portal vein. What the heck is the portal vein? Do we remember that? I hope we do. I don't know. Portal vein. Huh? What is it? Does it? There you go. The portal vein is all the veins basically from our stomach and our other intestines Remember, they like our pulmonary system, it's a branch. They branch away from the stomach, and before we take all those nutrients back to, okay, the portal vein, if it's in circulatory system, chapter 16, the portal vein, a portal system, the portal vein is a venous flow from our digestive tract, which, like you made the point, it's a vein, and it's oxygen poor blood that's coming back from our digestive system, but it's nutrient rich, right? Because it's coming, all these veins are coming from the digestive system, so anything we have already absorbed is going to end up in the portal vein, and it takes a drop off. It takes a portal over to the liver, runs through the liver, and the liver does a lot of stuff with those nutrients. It might filter out toxins like the alcohol you drink, or the medicine you take. It might take some of those minerals and start making vitamins. It basically is a big filter for toxins, is what our liver does, okay? But that means that blood has to leave our digestive system and make that stop, that portal over to the liver before it goes back. Because basically comes in the portal vein, does its rigmarole. These are my two capillary beds. And then comes back and dumps back into the vena cava on its way back into circulation. That was the portal system. Hepatic portal system is what the book calls it. Refresh yourself, chapter 16. This is important for kind of understanding the liver, because a main function of the liver itself, anatomy-wise, is kind of all about this portal vein circulation. It's kind of all about this stuff coming in and our liver being able to filter out those toxins and deal with things that are coming from our digestive system. So that's what page 433 is dedicated to. It's dedicated to kind of showing you the zoomed in of what this looks like. And so basically our liver's broken up into these little sections. They call lobules, but I'm not stressed that you know what a lobule is. I think it's funny that they use another word that we've seen before with bone to talk about something. Do you see canaliculi again? Does that sound familiar? Why are we using two words the same? Okay, I don't know. Not stressing you too much about that. But they're showing you kind of what it looks like. So basically the liver has a lot of blood flow through it. So like a liver injury in a car accident or some other accident, just like the spleen injury, would be pretty bad. Any organ like that has a lot of blood flow through it, if I injure it, it's always going to be kind of bad news for bleeding risk. But you can see that they're coloring blue. This is that, come on, Pen, wake up. They're coloring in blue. Let me do blue. The portal vein. So portal vein comes in. This is that O2 pore, because it's coming from our digestive tract, but nutrient rich, coming in from our digestive tract. So these are just all millions of these throughout the liver look like this, these little lobules that have this design. So they come in, and while they're there, the liver cells can do their job. So I think it's decent to know what a liver cell is called, which is pretty straightforward. It's called a hepatocyte. You know that cyte means cell already, right? Now you know hepatic means liver, so hepatic cyte knows that I'm definitely talking about the liver. So there's all these hepatocytes here. That's job is to start filtering out stuff, maybe take that stuff, make vitamins out of it, all sorts of stuff like that. These little guys. You can also see that our arterial blood, again, the liver has to have normal systemic arterial flow. That's all left from the aorta originally. Sorry, I feel like I'm already losing my voice, so it's going to be a long day. The arterial flow comes in too. Again, remember the same thing with the lungs. The lungs have their own portal system too, called pulmonary circulation. That's the blood flow off the right side of our heart to get oxygen. But the lung tissue and the lung cells, just like the liver tissue, the liver cells, hepatocytes, still need oxygen-rich blood. They still need some positive stuff from the lungs. And so their oxygen-rich blood coming from our systemic circulation here, and they end up like mixing, which is wild because they mix, and then they're eventually going to go back in the form of all venous flow. Come here, I'm on my tippy toes. All venous flow back to the vena cava. Eventually. That's what they're doing. So they call this like spot where they mix together, or this area where that oxygen poor, nutrient rich blood comes in, they call it a sinusoid. So I'm going to highlight that word as one. Sinusoid, it should, I think it's bolded in the book, isn't it? Yeah. So basically this pathway of blood in between the cells is called a sinusoid, and that's just where this filtering process is. This oxygen poor, nutrient-rich blood hits these sinusoids, and then eventually it's going to mix up with the oxygen-rich blood and go back to the vena cava together, hunky-dory. Now, what is the green for? They have these canaliculi. I'm not going to stress you know canaliculi, but they're highlighting these green tubes. It makes sense, the portal vein and the arterial flow, and then everything back to the vena cava, but there's a green tube. What is that carrying? Anybody read ahead? Huh? Bile. Bile. Bile is going to be a key thing with the liver. So I'll keep it, I guess I'll color it green. So this green structure, the liver produces a really important thing for digestion called bile. And that's what's in the green. And so that's got to go somewhere, and that's the key of the liver. What now? I haven't even really talked about the liver's digestive point yet. I'm just rehashing the liver and what it does and the flow, blood flow through it. The liver produces bile. That's a big thing the liver does for us. So producing bile is a big deal because we need bile to help us digest fat, okay? Now, why do you think I'm saying helps digest fat and not just saying digest fat? There's a reason I chose the wording helps. Anybody have an idea why that would be? Any guesses? Oof.
Some of it's stored.
No. Good guess. She has said some of it's stored. No. There's a difference I'm making. The reason, I'll give it to you, fine. No one's awake this morning. I know. You did try. I appreciate the trying. Helps digest fat. The reason I'm saying that is that digestion is essential, is right, breaking down food, right? And so it does do that, but I always make the distinction helps because if I asked you, does bile chemically digest fat, meaning break it down into a chemical component, the answer is no. The answer is no. What bile does is this word. The book uses it later. I'm dropping my recording device. The book uses it later in the book for some reason. I don't know why. It doesn't actually define this word until, which page? A few pages, but I like to introduce it earlier. It doesn't really introduce this word until it talks about how we chemical digestion and absorption on page 438 and 439. If you look ahead, though, 438, 439, we'll get there. But it talks about how we digest each thing. So carbs, right, sugars, proteins, and then you see fats there on 439. Has a word in bold down there about fats. Emulsification, you see that? That E word, emulsification. So what bile does is emulsification. That's why I say it helps. Because if you read what emulsification is, it emulsifies fat. What that means is that fat is always one of those weird molecules. Fat floats, okay? Fat is not like water soluble. It does not break apart necessarily in water. So it needs a little extra help to digest, okay? The stomach acids are going to break it down, but for us to break fat down chemically, and again, this has a lot to do with why some people deal with fatty meals better. Like some people can go to Waffle House on the reg, and it's fine. And some people go to Waffle House, and they're in the bathroom the rest of the evening, okay? It kind of just depends on your system, but it's all about the ability to digest fat. So high fatty foods, if you don't have that ability, are going to cause you a lot of problems. what bile does is emulsify it. So taking a sidebar, the book doesn't explain this very well, so I'll draw a fat molecule. A fat molecule is a big clumpy thing that's not soluble in water. So they usually make adipose tissue look fat or like yellow. So here's a lumpy fat molecule, okay? And that's kind of what it is. It's not water soluble. So if I had an imaginary, just imagine you had a droplet of this stuff and you placed it in a cup of water, it's not really going to go anywhere. It's going to stay what it is, right? You ever tried to chew fat on a steak or a pork chop or something like that? It's greasy, it's chewy, right? It's not water soluble. It's not going to dissolve in water. So we have to find another way to help break this down. This is what bile does. Bile is a chemical that comes along that's made by the liver. So liver, bile comes in, and bile has the ability to help break this guy down. But it doesn't fully break it down chemically. All it does is turn this one big lump of fat into a bunch of fat droplets, is how the kind of book describes it. A bunch of little tiny fat droplets. And all that does is make it easier for us to finally chemically digest it. It's basically like if our body has a hard time kind of getting a big clumps of fat, but if we get them down to a cellular size, we're a little bit easier for some of the enzymes our body has made. We're just dropping all kinds of stuff this morning. Fat, it's something that we can chemically digest. To do that, we got to make it smaller and basically easier to fight, so to speak. Easier to chemically break it down. Let me not say physically. This would be like physically breaking it down because it doesn't really chemically change it. You see what I'm saying? It doesn't change the fat big molecule. It doesn't really change that into its like basic chemical form of lipids yet. It just emulsifies it, turns a big clump into small droplets so that later we have the easier ability to now change it chemically and break it back down into lipids we can use. Does that make sense what I'm saying? Okay. So that's what emulsify means. So if I said, does bile chemically digest fat? The answer is no. It emulsifies fat, which long-term short story is just helps us break it down more easily, okay? That's the role of bile. So I don't know why the book waits till later to say it, but emulsification. Emulsification is going to be a big theme I give you with that. And you're like, why are we talking about all this stuff with food and chemicals and all that stuff? You're going to have a nutrition class. We all had to do them. I had to do another nutrition class, my master's of nursing education. What? Yeah, anyway, I don't know. Nothing to do with clinical nursing. Still had to have nutrition, so I don't know. Not my strong suit, but that's how I keep nutrition simple. I just always think of those three: proteins, carbs, fats. I want to get everything down to its chemical form in that. Bile helps us do that. This is a zoomed in picture of what's going on inside those lobules in the liver, 433 still. It's just giving you a bigger picture of like what's happening. Again, portal vein comes in, brings that oxygen poor but nutrient-rich blood in. Oxygen-rich blood comes in the normal arterial flow. They serve the cells, so the hepatocytes have to kind of work. Then they get their food in the form of oxygen as well, so they live. And all that dumps back into kind of a central vein, dumps out of the liver. But we have these areas too where we're always trying to, again, removing debris and bacteria. So I mentioned these guys before, but remember our discussion about phagocytes? The cells that eat things. We have one of those phagocytes was neutrophils, the most abundant one, but we have macrophages, which are just bigger neutrophils, but they're so big they don't move around a lot. So I mentioned places in our body have their own macrophages. In this case, a Kupffer cell is a liver macrophage. The reason I'm highlighting that is there is some medications, there's some diseases that affect the abundance of Kupffer cells in the liver, which means it affects basically your ability to get rid of debris and bacteria sometimes in the liver if Kupffer cells aren't present. But they're just a macrophage. They're another cell-eating cell. They're just a macrophage. They're big. They don't really leave the liver. So they have their own special name because they're special. Kupffer cells. I hope everything I'm talking about has made sense so far. So, which liver structure filters blood to remove nutrients as well as toxins? This will be a structure. This is the one structure I said I would highlight. See what your guess is. Two. I hear two. Most people are going with two. Yeah, so this is how I would define sinusoids for you. Sinusoids is where that portal vein meets up with the arterial flow before it dumps back into circulation. But that's kind of where all this meets, and that's the best opportunity for our liver to do the most work. So where it does most of the removing of nutrients, filtering out toxins, where it does most of its work is in the sinusoids, where those portal vein comes in from the digestive tract on its way there. So that's the liver. Oh, I have another one. Aha. Let me see if I can do. Does that work? Oh yeah. Liver has many jobs. Some say it's a workaholic. It secretes clotting factors, produces proteins, stores and releases glucose, processes vitamins, filters toxins, and secretes something that helps us digest fat. Bile. So it does not do anything else on this list except the bile component. I would say this question's a good one too, only because this is my favorite summary of everything the liver does. And the liver does a bunch of stuff, but if you want to summarize how important it is, look, produces clotting factors. What's that good for? Blood clotting. Proteins, we know we use that a lot, right? Glucose, that's the endocrine part, stores and releases glucose. Processed vitamins, we want that to happen. Filters toxins, like, again, my best example is alcohol. Most of us always know the joke about drinking alcohol in my liver, but that's a toxin. Ethanol, alcohol is a toxin. That's why it makes you drunk, but because the liver kind of has trouble filtering that out when you drink it rapidly, right? So I think that's a great summary of all the big stuff our liver does and the bile part, which the bile helps us digest food. Does that make sense? That's why I'm kind of holding on this for a minute, just saying. If you want a summary of all the big stuff the liver does, that's it, okay? So the gallbladder is the liver's like little brother that doesn't really get a lot of love, okay? And it doesn't serve a huge role, actually. So on this picture right here, they have the pancreas below it. They've just removed the liver, basically. So the liver this is a bad example for scale, but the liver sits like this, and the gallbladder sits on the back wall of the liver. So they have this picture, they're just removing the liver so you can see it more clearly. So the gallbladder is just this little, it's on the underside, posterior side of the liver. It's just a tissue sac, I guess, for lack of a better term. Tissue sac, I don't know what you would call it. A sac of tissue. And the only job of the gallbladder, is to concentrate bile. So bile makes its way from the liver through a ductwork system. Remember DUCT, like duct tape, ductwork? Ductwork is always just talking about tubes in our body going from somewhere to somewhere else. So we have a series of ductwork that carries the bile from the liver. They call those the hepatic ducts. They come down from the liver, which makes sense, right? Because it's hepatic ducts. So bile is made in the liver. I don't know why I drew it backwards, whatever. Comes down the hepatic ducts and makes a stop off here. So all the gallbladder does is help concentrate it. It's basically storing bile for later use. Consecrate and store. Concentrate, not consecrate. Consecrate? That's like consecrated engraved. No, I don't know. Concentrate and store bile. So bile, as far as its chemical components, made up some stuff that basically gets more potent the more it stays stagnant, okay? It's kind of like that thing I've mentioned before. It's like a river or a creek that's flowing is always going to be a little bit cleaner water than like a pond somewhere where the cows are walking around, right? And there's probably cow poop in there, and there's algae, and it's stagnant water. Does that make sense? The difference between like a creek flowing and stagnant pond water? You would look at those two waters and go, well, one of those is pretty nasty, right? So what the gallbladder really does is kind of help stagnate and keep the bile in like one spot and not flowing to let it get more potent, basically, okay? To make it more effective at emulsifying. So concentrate is what I mean by concentrate, is like make it more potent, concentrate it, and store it there. So the liver's always making bile, but maybe we're not eating right now. We're not eating a high fatty meal. We don't necessarily need a whole lot of bile being released. So it's somewhere to store it. So while the liver's always making it. And then when we eat a meal that's maybe high in fat, now we have this storage sac that can send a big impulse of really concentrated bile to help emulsify that fat really well. Does that make sense what I'm saying? So that's the only role of the gallbladder. The gallbladder doesn't make bile. The gallbladder doesn't make any enzymes of its own. The gallbladder is just a tissue sac that's a little brother, the extension of the duct system of the liver that is just going to hold and concentrate bile for the liver. So let's say you went over to Taco Bell and you got you the greasy food or whatever. By the way, Taco Bell, too expensive. I'm irritated by that still. I'm just mad. Okay. Used to be able to get a bunch of stuff. I mean, okay. Tacos used to be like 80 cents, okay? What happened?
How much are they now?
Like $1 something. All right. I can't do Taco Bell as much as I used to, though. That would mess me up. All right. Maybe my liver's not doing well. I don't know. So I want you, this is a need to know. Ding, 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 need to know. Shout it from the rooftops. The ducts, the name of the ducts. So if I'm following bile, if I'm riding bile like I'm on the Magic School Bus, which would be a really weird episode of the Magic School Bus if they're in the bile ducts, but I'm riding the bile ducts. I'm made in the liver. I go through the hepatic duct. There's a right and left, but hepatic ducts. There's only a right and left because, remember, there's two lobes of the liver. That's the only reason there's a right and left hepatic duct. But they're coming from, if they're hepatic duct, that means they're coming from the hepatic area of the liver. You got the gallbladder, the duct from here. So there's what's called, between the liver and the gallbladder, common hepatic duct. This one right here. So we have the common hepatic duct. So basically there's hepatic ducts, common hepatic duct, do different colors, which is this guy here. The common hepatic duct is just on the way to, okay, the gallbladder, or a little bit, or on the way down towards that main central duct. The duct between the gallbladder and that main one is called the cystic duct. Cystic duct. Let me find a different color. Cystic duct. And this is in your book, so you don't necessarily need my colored picture to help. So the duct system between the gallbladder and this main branch is called the cystic duct. And has anyone ever had, you've had inflamed gallbladder or issues with your gallbladder? Anybody? A few people? So a lot of times they call that, it depends, but it's always the gallbladder. If you want to know something for the future, there's a couple names that make sense with the gallbladder. The gallbladder is also kind of known as like, that's blue, well, that's fine. That's chole. So if you've had your gallbladder removed, you had a cholecystectomy. You probably had chole, gallbladder out, and cystectomy, which is cystic duct. So when they do a cholecystectomy, when they remove someone's gallbladder, they're removing the chole, the gallbladder, and the cystic duct. Cholecystectomy. Ectomy means to remove. Okay? Toectomy means, no, I'm just kidding. It's not called a, it's just removing my toe. So an ectomy is always removing. So these are not stuff I test you over. I'm just trying to give you some free words of wisdom, I guess, or free medical terminology words. So ectomy is like removing. Chole is usually referring to gallbladder. So if I had a someone says, oh, I had to go in and have a cholecystectomy, they're saying they removed my gallbladder and they removed my cystic duct. That's what they ectified, that's not a word, my chole and my cystic duct. Because you'd be surprised, there's some nurses I could ask right now if I said, they would know what a cholecystectomy is. It's, oh, you had your gallbladder removed. Okay. Did you know they were also removed the cystic duct? And they go, what's the cystic duct? And I go, okay, moving on. They're out there. There's plenty of them. But I want you guys to always be seeking knowledge. And what I mean by that is that if you don't understand something, learn about it, okay? Don't just write it off as, whatever. There's a bunch of nurses out there that are always just doing stuff and they don't know why. Everyone does that. We all do that in our jobs sometimes too. I want you to have an inquisitive mind. I want you to find out, why are we doing something? Is there a better way to do something? If you understand why you're doing something, you actually understand it. If you just do things because someone told you that's how you do it, that's a bad way to go about life. So be inquisitive. So a lot of this stuff I had forgotten. I had to reinvent myself and think about it again. So just always keep learning. Always keep learning. So if I'm following the bile, hepatic duct, common hepatic duct, where they meet. So the two hepatic ducts, common hepatic duct. Cystic duct is the duct between the gallbladder and the main branch. And then I have the common bile duct. So there's a reason I'm highlighting these. Common bile duct is that where they all meet up and head down this way. Sometimes it's referred to as CBT or T. I don't know where the T came from. CBD, and not like, the good stuff. I figured someone would get that joke. More of a joke of all the CBD oil places that pop up around here. There's like a bunch. Common bile duct. So the reason I'm highlighting the duct system has a lot to do with something called gallstones, which we can save for a break. But gallstones is talked about at the bottom of 434 down there. You guys see that little life lesson there? So gallstones is something that's worth knowing about. Gallstones is really kind of like a disease process, but it makes sense. So we'll just finish this and then we'll take a break. Because I think this would be better, because we'll move on to the pancreas, so we'll kind of move on. So again, gallbladder, just a baby brother of the liver. Its only job is to kind of hold on to bile and release it whenever it feels stimulated from food entering this pathway. So we're going to talk about where all these enzymes and the bile and all this stuff is going. It's going to this first section of the small intestine after the stomach, and we'll talk about it. So the life lesson about gallstones. So the reason I highlighted the ducts is, what are gallstones? So gallstones, if people heard of kidney stones, these are the same thing. Gallstones are just hard masses. Sometimes people have a little bit more potent bile depending on their diet. So what bile is made of, it's kind of redundant, but it's made of, this big key component of what makes up bile is, ironically, cholesterol, which is in the lipid, the fat family. So we use fat against it. We're like fighting fat with fat, which is crazy. But a lot of what bile is made up of is what they call bile pigments, bile salts. You don't necessarily have to know this list, but I'm just kind of giving it to you to help. Phospholipids. So we use fat to fight fat in our bile, which is interesting. So bile is cholesterol, bile salts, pigment. The main point I'm making here is the cholesterol one, because this equals if it concentrates more, or imagine this, right? I have a higher level of cholesterol in my bloodstream. Guess what raises here? This, which could, if this is high, if cholesterol is high, this could equal gallstones. So gallstones are mainly made up of cholesterol. And the book should make that point. Yeah, excessive cholesterol in the bile. So basically gallstones, the main chemical that makes up gallstones, when they harden, they're just like, they're literally stones, pieces of bile that clump together that become hard. That is cholesterol, what makes it up. And that's a problem, right? If I'm supposed to fit a liquid through a bunch of ductwork, now I have a hard, rocky, crystallized structure. What happens? Well, it's going to get lodged somewhere, right? So maybe it gets lodged here, cuts off the gallbladder. That causes inflammation in the gallbladder. Maybe it gets lodged here in the common bile duct. That's a bigger problem though, isn't it? When you think? Because it's blocking all bile flow. So that means that bile is going to back up into the liver. It's going to back up that way, right? That's bad news. And that's where we talk about things like if someone has cholecystitis, which means cholecystic duct inflammation, cholecystitis, see that, right? It's talking about they probably have a gallstone blocking something or something's going on. But if I have gallstones, that's cholelithiasis, but that doesn't really matter. It's going to block bile flow. And again, that's bad news if it blocks the flow from my liver. My liver never stops making bile. So eventually, bile is made and backs up into blood flow. And this is where you get, if I have a backup of bile, if bile backs up, a bile backup, a bile backup is always going to equal jaundice. That jaundice is the yellowing of the skin, the yellowing of the sclera of the eyes, yellowing, because the main component of what makes up bile is cholesterol, but also these pigments. So bile, the other point is that body of work section is a really good read too, on page 434, the gallstones and that life lesson. The main component that makes up bile pigment, the component we use in our body, remember our body is always recycling stuff, right? So remember the heme of hemoglobin? We break it down. One of the things that makes up heme is called bilirubin. And bilirubin is a bile pigment. And so it gives what bile does, our bile actually, this bile pigment is what makes our stool the color it is, like brown or whatever, dark green, is the bile pigment. If you had no bilirubin and no bile pigment in your bile, or really no bile at all, like if you had no liver, which would be impossible, and you just imagine that for a second, if you weren't getting any bile to your stool, guess what color it would be? White. Colorless. It really, I've seen it. With a complete blockage and no bile, people will have white stool. It's rare that it happens. It's rare that it gets that far, but it can. It's wacky. But that's bilirubin is the component we get from recycling. So our liver recycles old red blood cells. A lot of that stuff gets reused, and some of it ends up as a byproduct to help us make bile. So you see how our body never wastes anything? So I told you before, when we destroy red blood cells, bilirubin is the main cause of jaundice, and we get rid of bilirubin in stool. The reason we get rid of it in stool is we use it in bile to help break down fat, and that ends up coloring our stool brown, basically, or brownish orangey, or brownish greenish orange, or whatever color. And that's what bile color is like. is that color, and that's what gives our stool the color, and that helps us break down fat. But again, if there's a problem somewhere along the chain and bile is not getting where it's supposed to go, it's not only going to cause our stool to change color, but that's going to cause it all to back up into the liver tissue, because the liver doesn't really know to stop making bile. It's just like, it's got a quota for the day of bile, and that's what it's making, right? It's just like, today's the day of the liver's operating, I'm making this much bile, okay? And so that's all it does. And so if it doesn't know better, it's just going to block up into the bloodstream, and that's where we get jaundice. And that's what the kind of body work's talking about there. So it's talking about bile is responsible for giving feces our color. A lot of it's not reabsorbed. We do reabsorb some of the bilirubin along the way, but a lot of it's not, and it ends up giving our stool our color. Ends up being waste, okay? So the biggest component from bile that's a highlight is probably understanding that a lot of what makes up bile is cholesterol, because then you know what gallstones are made out of. Does that make sense? And then the bile pigments of bilirubin, because then you know this comes from red blood cells, but then you know what bilirubin gives stool its color. It is a waste product. For the most part, we do reuse it to help make more heme, but overall, it's a lot of a waste product. But also, if I have too much of this, it's going to give me that. It's going to give me that yellowing, okay? So that's on that page about the gallbladder. The gallbladder itself is a pretty small portion of that. So you can live without your gallbladder just fine. If you got a gallstone and it blocked up and you had to have your gallbladder removed, gallbladder and the appendix are probably some of the most common abdominal surgeries out there. The gallbladder can be removed. They do that cholecystectomy. They cut everything off here and just let the liver. What that means is that you don't have the ability to store and concentrate bile very well. You still make it. So for people that don't have a gallbladder, they really don't deal well with high fatty foods. Really don't. It's not a good idea to go to your really greasy like mom pop restaurant. It's not always a great idea to do that. It can't handle it as well. But you live.